So the major clinical trials ongoing at the moment, well actually most of the reports are the ones which have just recently closed. So the European group reported a study comparing DRC, chemotherapy, versus bortezomib plus DRC, and that showed that both regimens worked well, that bortezomib gave you earlier and faster responses, but overall the advantage was not marked. And then, of course, there were the novel agents. So at the moment, we're between clinical trials. We're trying to decide what the next step forward is, and you know, whether we should sort of migrate from the chemotherapy age to a novel combination novel agent age. And I think that, you know, we are going to hold a clinical trials consensus panel discussion tomorrow, in fact, where we'll hear about the priority from the group. But I would imagine that what will emerge will be that there will be a push towards fixed duration, novel agent combinations, and perhaps a push towards a genomic guided clinical trial where high-risk patients can be treated differently from standard risk patients.